Hi everyone, this is Dr. Richard Tran from Chiropractic. I wanted to make this track specifically for Medicare patients because we often find that Medicare can be confusing. Some people have secondary coverages, and although this track is going to be lengthy and I'm going to be reading a little bit, I want you to fully understand Medicare so that you're well informed on what they cover and what they don't, because there's a lot of assumptions being made. So I'm going to cover three of them here. The first assumption is people assume that Medicare covers for their chiropractic visits. Now, the thing is, that's true when it comes to spinal care only. Okay, they don't participate in things like examinations or cases that involve extremities or even other procedures that are performed here at the office. In general, when you schedule your regular visits as a green visit that just covers spinal adjustments, that will be with Medicare coverage. But when you schedule a red visit, that's for things that involve extra time, or you want to address multiple areas, or you want to utilize some of the other modalities that Medicare doesn't cover. Okay? The second assumption that people make is that they believe that their secondary insurance will actually pick up for what Medicare doesn't. Now, that may be true in the cases of the spinal adjustment. 90% of the time, they pick up for the rest of that spinal care. But in most cases, they will not pick up for procedures in things like a red visit. And in those cases, you'll actually be responsible for paying for those procedures. You want to check with your insurance company just to be able to make sure. And we suggest that you talk to the front desk if you want to look at other options that are available to you. The last assumption is people think Medicare is unlimited. Now, I'm not sure where people get this from, but Medicare actually judges the number of visits that they recommend by the severity of the diagnosis. So if a person had a strain in their lower back, they're expecting that this recovers very quickly, usually within about a 4-week time period. Now, if you had something that is more chronic, like lower back, they know that this can typically take longer, but that's indicated through the diagnosis. And what they ultimately want to see is that a patient is progressing under the chiropractic care and not maintaining a chronic condition. So therefore, chiropractic care is not unlimited. There's going to be a point where you have to decide that where you're going to be in so much so pleased with the results that you're not going to feel any more pain. At that time, we would dismiss you and you could just come in for occasional flare-ups if that came up. For others, though, with chronic conditions, there can be a case where chiropractic care is preventing the problem from getting worse. Or in other cases, you just want to get adjusted for health reasons. Now, in those cases, what we do is we just switch you over to a self-care plan to help you maintain your body in good health. Okay? So to just summarize, Medicare doesn't cover all the procedures. Secondary insurances can cover things like the green visits, but you'll usually have to some form of responsibility in things like a red visit. Remember to check with your insurance company, and you can always talk to the front desk to look at your available options. And lastly, Medicare is not not unlimited. There will be a point where you have to decide where you want to lead your care. And I know this is a long track. Get some time to review it. If you have any questions, ask the front desk, and we're here to help you with anything that you might have.